three major roles of my job. One, which is kind of the most simple, is you're in the clinic. So you're seeing patients. Someone comes in with back pain, so you have to work them up. And that's where a lot of your differential diagnosis comes into play. That's where you're going to be looking at the x-rays, looking at CT scans, MRI scans, reviewing charts, looking at, what their primary doctor or their pain doctor sent them over here for. And so that's a lot more of the, thinking about it, looking at what we have, what do we need? Is this person a surgical candidate? Are they not a surgical candidate? So it's just a lot of information processing. The second portion is the inpatient rounding. And so these are people who stay in the hospital, sometimes just overnight because they had an elective surgery and you go see them the following morning for a post-op visit. Sometimes, because we have the trauma hospital here, there are traumas that we have seen on call. And so we'll have to go in and that's usually a bit more of an acute situation where the information coming in, you got to process it pretty quick, decide what needs to be done, image-wise, lab-wise, and you kind of quickly do things on an inpatient basis. And then the third, major portion of my job, which I think is the most exciting, is the OR portion. So this is going to be very much the hands-on procedures. As a PA, you'll be a first assist to the surgeon. So you're on one side, they're on the other. You're helping really with whatever the case needs to be. Sometimes it's as simple as retracting. It can be cautery. It can be the closing. It can be assisting with the exposure. So really, whatever the case, requires, you're that extra set of hands. And I think if I compare what I do now versus what I did, 2 months into this, it's drastically different. As a recent graduate, you're going to be a little guarded and not a little unsure as to what you're doing. But after you see the cases, 10, 20, 100 times, you start to really understand the rhythm, what needs to be done, what you're looking for. And I think you can really have this opportunity to really be an assistant to your primary surgeon and then really try to increase the speed of the case, the safety of the case, patient outcome.